What do you think the major barriers to adoption are?
In that case, it's really, I think, about how you acquire that technology. It's really needs to be, it's sort of a new frontier. There's a lot of sort of unknown about it. A lot goes to how the health systems want to brand themselves and how they want to adopt that. So I think there really needs to be a strong sort of OpEx model or acquisition. There needs to be, we're looking at aggressive alternative models to just the straight capital acquisition of that. So, we think we've got a very, very aggressively packaged solution, but I think it comes down to where does that stack up in the strategic decision making. I want to buy an MR, I need to, deploy CPOE or something else. Could be beds, but we think its time is now. There's a lot to be garnered from that solution.
And can you give me an example of a hospital that has adopted your solutions and benefited from that?
Well, we're in the process right now of deploying that in a hospital in Pennsylvania to address CPOE rollout, security. They had some issues with regards to the time it was taking as the physicians were making their rounds, roaming through the offices, accessing terminals outside the room. We were able to take steps out of the workflow to improve the speed in which they could make their rounds, but also give them more time back into their patient experience, to spend time with the patients. So that's underway, and there's a couple of other projects, same type of solutions. Most of it's around sort of the CPOE. How do we assist that?
Now, I talked to you a little bit before we started offline, and you told me a little bit about Siemens looking at social media and leveraging that in the future. I wonder if you can give me some high-level ideas about what you're all thinking about in social media.
Well, obviously, the social media phenomenon is it's here. There's no denying it. It's right here. I'm here. I'm testimony to it.
Hello, Twitter.
Old world guy in social media, but I think what we're aggressively looking at is how to leverage social media into enterprise strategies, and we're doing two things. One is taking advantage of leveraging Twitter to try to help the health system be able to get more timely feedback, monitor on a proactive basis, maybe some things that are being said about them. This is just one vignette, but I mean, we see a tremendous play of social networking. We're aggressively got our developers working to integrate it. We're showing it at a show actually 3 weeks from now at VoiceCon, which is a major show in North America, where we're going to show Twitter integration. The other one is we're also looking at the integration of Google Latitude into our unified communication strategy to assist with presence and location. So these are trends we think have great upside potential for healthcare, and we're very, very much looking at how do we integrate them into our whole unified communication strategy.
That's pretty exciting. Well, I think we have a question from the Twitter gallery, and Dr. Anonymous is going to tell us what that is.
Probably just better to read it off here. So it says, how important is having a common platform or having platform-independent hardware and software?
Well, I mean, I think historically that had been really the Achilles heel. I mean, it was a very proprietary type of technology implementation in days gone by. What Siemens has prided themselves and invested millions and millions and millions of dollars in is to develop an open standards, open technologies platform. And where we're going with sort of what we call open exchange is the ability to layer on top of really any legacy communications technology, call them an open exchange, sort of a translating engine that will allow us to unify some of these applications and provide a unified experience. So it's way less of a problem than it was. So we're aggressively working to try to address those historic sort of barriers that would prevent the adoption of some of these technologies, because in large systems we know a lot of them have come together through mergers and acquisitions, and there's multiple platforms. So for senior management in healthcare to get the value of what they've invested on, we're looking at these type of technologies that would give them that benefit to take advantage of that, but at the same time not hold them back.
What are the remaining barriers that you see most commonly?
Well, I mean, there's a certain level of technical requirement in that legacy technology that has to be up to a certain standard to take advantage of some of these open protocols. And I think if they're not to that level, then there's a capital barrier. They're going to have to either upgrade the system to get to a platform that would allow it to exploit those new technologies to exploit it. But that's something we look at. We know that in healthcare there's not a lot of dollars lying around for investments, and when they make these large investments in platforms, historically they're in for a long, long time. So that's why we've adopted open standards. That's why we looked at ways to try to make sure that we could take advantage of what they've invested in. In some cases, it works. And, and when I say works, I don't mean like our technology works, but it works that we can take advantage of the backward legacy solutions. In other cases, they're just too old and they needed to be upgraded to some newer platform. So hopefully that answered the question.
Do you find that most physicians understand all of the things that Siemens is doing, or they think of you as sort of a radiology type solution? Siemens, you've got a new CAT scanner or something. I mean, it seems like you're doing so much, and I wonder if the average doctor really understands all of the different streams of things that you're working on in your company.
I think that there's Siemens got a great brand name in healthcare, and I would agree with you that when you hear Siemens, the first thing you do think of is the modality business side of the business and the IT side. Around the world, Siemens Communications is a well-known name. I mean, it's one of the major players, the most lines, largest customer. In the North America market, we're a little less known. There's a lot of noise from some local competitors we compete with, and I would say that we're probably one of the better kept secrets in terms of what we can do in healthcare here in the U.S. So I would encourage them, if they haven't seen and heard and looked at Siemens, they should, because there's a lot of good things that we can do with them. And again, I think we really understand healthcare. We've been dedicated on this market in the U.S. on the communication side for 13 plus years with dedicated teams. So I think that translates into very, very powerful solutions, and we understand their pressure, so that hopefully allows us to engineer some very, very aggressive package solutions for them.
Okay, so as we wrap up, I wonder, what's the most important thing that you would like our audience to know about Siemens today?
Well, as I said, I think from our standpoint is in the U.S., we're more than just a communications company. We're really about communication solutions, and we truly do understand the pressures. So when we come to an engagement or an opportunity, it's really about how we can support your strategic imperatives, their strategic imperatives out there, and solve the problems. It's not about just bringing technology for technology's sake. So I think we're the best kept secret in North America, and I think if they were to look at Siemens, they would find some very, very exciting things that would have direct applicability to their markets.
And how can people get in touch with you?
Well, we're here at HIMSS, if they're here at the show, or our website, the Siemens website that's pretty easily found. Surf through siemens-enterprise.com.
And what's your booth number? Do you remember?
I don't know.
That's okay. I know. I don't know
I haven't
either.
even gotten it.
Sorry about that. Okay, you don't know.
It's in the show guide.
Okay, that's right. I'm sure it is.
So, yes,
So people find you that way.
Hall C, so
okay.
That's we're there. But
all right.
Thank you very much for the opportunity.
Fabulous. It was so great to have you
too.
here today. Thank you so much.
Take care.
Okay. That was Jeff Forbes from Siemens, and thank you so much for listening in. In another 10 minutes, we'll go live with our next interviewee.